Welcome back to our channel. Today we'll be discussing cyanide poisoning, a life-threatening condition requiring prompt diagnosis and treatment. Cyanide poisoning can result from inhalation, ingestion, or dermal exposure to cyanide compounds, commonly found in smoke from fires, industrial chemicals, and certain plants like cassava. Cyanide exerts its toxic effects by binding to cytochrome C oxidase in the mitochondrial electron transport chain, inhibiting cellular respiration and ATP production. This leads to a shift from aerobic to anaerobic metabolism, resulting in lactic acidosis. Clinical features include headache, dizziness, shortness of breath, confusion and seizures, progressing to cardiovascular collapse, respiratory failure, and coma. Key signs of cyanide poisoning are a bitter almond smell on the breath and cherry red skin due to increased venous oxygen content. This occurs because cyanide prevents cells from utilizing oxygen, causing a rise in central mixed venous oxygen saturation, SVO2, as the blood returning to the heart remains oxygen-rich. Laboratory tests reveal metabolic acidosis with an elevated anion gap, elevated lactate levels often exceeding 8 millimoles L, and reduced arterial venous oxygen difference. The mainstay of treatment involves rapid administration of antidotes. The first-line treatment includes hydroxocobalamin, given as an initial dose of 5 grams intravenous over 15 minutes, which binds cyanide to form cyanocobalamin, or vitamin B12, excreted in urine. Sodium thiosulfate can also be administered at a dose of 12.5 grams intravenous over 10 minutes, enhancing cyanide detoxification by forming thiocyanate, which is renally excreted. In some protocols, sodium nitrite is used to induce methemoglobinemia, which binds cyanide, though this is less common due to potential side effects like hypertension. Supportive care is critical and includes securing the airway, providing 100% oxygen and treating seizures with benzodiazepines. Complications of cyanide poisoning can include neurological deficits, cardiac arrhythmias, and persistent metabolic acidosis. Now, one high-yield point for you to know: elevated lactate levels often exceeding 8 millimoles per liter in the context of metabolic acidosis and an elevated anion gap in absence of other causes is a critical diagnostic clue for cyanide poisoning. Additionally, an often overlooked point is that chronic exposure to low levels of cyanide, as seen in some industrial workers or individuals consuming large quantities of cyanogenic foods like cassava, can lead to subacute symptoms such as weakness, ataxia, and thyroid dysfunction due to the gradual buildup of thiocyanate. Stay tuned for more in-depth explorations of critical medical conditions and their management, and don't forget to subscribe for more high-yield medical content.